Hi, welcome, and good evening. Thank you all for coming out, and I know we have a goodly number of folks also on our live stream here this evening. My name is Ann Peters, and I'm with the Pulitzer Center, which is a journalism and education organization with the mission to bring together folks and champion the power of stories to make complex issues relevant and inspire action. We're here this evening for the event, Extremes, Protecting Worker Health in a Warming World. And thanks to our partners who organized the event with us, the Association for the Advancement of Science, AAAS, and Science Magazine. This event grew out of reporting that the Pulitzer Center supported, including with Science Magazine, and it's really wonderful to have several of the journalists with us who focused on health, climate, and labor in those projects. I look forward to learning more and consider with our experts next steps and answers to such questions as what models for protection are already in place, what are those limitations, and what might come next? Are there business case models for protections? And how are workers themselves responding to efforts for protections in their workplaces? We're eager for your thoughts too, and we'll make time for audience questions. And we'll also invite you to tell us directly some things that you think about even after with a QR code we'll put up and a survey that we'll share with you there to come. I'd like to introduce and really get to the meat of the evening, our panelists and our moderator. Aryn Baker, here in the first chair after Tim, is an award-winning journalist with more than more than two decades of reporting, editing, and video experience for Time magazine in Europe, Africa, the Middle East, and Asia. She covers human impacts of climate change, as well as food security, climate migration, and extreme heat. She also is a Pulitzer Center Ocean Reporting Fellow. Barak El-Ahmed is a research fellow in the Exposure, Epidemiology, and Risk program at the Department of Environmental Health at Harvard T.H. Chan School of Public Health. He holds a medical degree from the University of Liverpool, a master's in public health from Johns Hopkins Bloomberg School of Public Health, and a doctorate in population health sciences from Harvard. Meredith Wadman has been a staff writer at Science Magazine since 2016 after covering biomedical research and its politics from Washington, D.C. for 20 years. Before then, she completed a medical degree herself as a Rhodes Scholar at the University of Oxford after attending medical school in her native Vancouver. Doug Parker is Assistant Secretary of Labor for Occupational Safety and Health at OSHA. Previously, he held positions as Senior Policy Advisor and Special Assistant at the Department of Labor, and he also served as Chief of California's Division of Occupational Safety and Health. Cathy Feingold is Director of the International Department at AFL-CIO. She also is Deputy President of the International Trade Union Confederation, an organization representing 200 million workers worldwide. Cathy has more than 20 years of experience in global worker and human rights issues with a focus on trade union rights, women's rights, and global economic justice. Now I'd like to turn the microphone over to our moderator for the evening, Tim Appenzeller, who has spent 30 years as an editor and writer specializing in science and the environment and is the news editor at Science. Thanks.
Thanks so much, Ann. Thanks so much, Ann. And thank you all for coming, those of you in the room and those of you online. So it's a pretty nice evening outside, and like every unseasonably warm day these days, it's a reminder of the big change that we're all going through. The world is getting hotter, and more people are exposed to that heat. Population is growing in the American Southwest. Cities are booming around the Persian Gulf and in the Middle East. Population's growing in sub-Saharan Africa. All these things are happening in the planet's hottest places. And even in rich countries, not everyone can stay inside in the air conditioning. So we're here this evening to talk about the really unacceptable toll that heat is taking on workers, the people who harvest our crops, fix our roads and roofs, deliver our packages. We'll talk about what science, government, NGO, and private entities can do about this challenge. And there is a lot of room for progress, a lot of need for progress. And we're really lucky to have here a panel of leading health and environment journalists, policy experts, and scholars to help us think through the problem and how it might be addressed, how it is being addressed. So here is how the next hour and 15 minutes or so will go. Each of the panelists will talk for about 5 minutes about the work they've done on the issue, how they see it. And they all have a lot to learn from one another. So we'll follow those introductory talks with a discussion on the panel, people asking questions of one another and drawing out the issues, talking about things that didn't come up in the opening presentations. And then we will open it up to questions from those of you in the room. There are microphones here. And online, you can put questions in the chat, and we will try to collect those and answer as many of them as possible. So we'll start with Aryn Baker, and she is going to start with a video. And it's up to me to start it. Oh, I'm sorry. I think I needed to do 2 clicks, right? Help is on the way. Thanks, Michaela.
The winner to organize the 2022 FIFA World Cup is Qatar.
But hosting an event of this size requires a lot of preparation. New stadiums.
Temperatures can exceed 50 degrees Celsius with almost staggering humidity.
Rights groups have highlighted the deaths of migrant workers during the construction of the state-of-the-art.
एउटा किसानीको घरमा त्यति हुँदैन अनि त्यही नभएको कारणले पनि अब देश जाने पनि बाध्यता भयो अनि अब गर्मीको टाइममा त धेरै गर्मी हुन्छ नाकबाट खुन जाने हुन्छ इत्यादि मान्छेहरू कोही ढले हुन्छ
We find lots of patients returning with kidney failure to our country.
For sure, the World Cup has accelerated the labor reforms in Qatar.
People are going there, and dead bodies coming every day.
Something has to be done.
Hi, so I'm Aryn Baker. That is a trailer for a documentary film project I worked on just ahead of the World Cup in 2022. And so when Qatar was awarded the right to host the 2022 World Cup, there was a lot of attention on the fact that summers there were in excess of 122 degrees Fahrenheit. How would fans survive, or the athletes? Then when the traditionally summer event was moved to December, attention then started focusing on the labor conditions for the people building the stadiums themselves, mostly migrant workers. I went to cover those 2 angles of construction, but also the source of labor in Nepal and other countries. My focus was on Nepal. But in the process of hosting this World Cup, Qatar went to some exceptional lengths to deal with heat. It built air-conditioned stadiums, and it implemented new labor laws to somewhat, asterisks, protect migrant workers from the heat. There was a lot of reasons for that. Qatar's summers are characterized by a hazardous combination of heat and humidity. And while the human body can protect itself from high heat through sweating, in high humidity, that sweat doesn't evaporate, which essentially means that the cooling effect of sweat no longer works, dehydration sets in, and overheating can occur with immediate and long-term consequences for health. So this combination of high heat and humidity is measured on a scale called the wet bulb globe temperature. And anything above 90 on that scale, which is essentially 100% Fahrenheit temperature with 30% humidity, or you could say 86 degrees Fahrenheit with 95% humidity. Anything above that is considered hazardous for human health, especially when combined with effort. Scientists on the panel will discuss that side more. But that effort and that heat together manifests most likely in outdoor labor. So, as Tim pointed out, that can be your agricultural workers, your delivery van workers, roofers, construction, anything along those lines. So while the high heat that we see in Qatar and that sort of precipitated these changes 2 years ago, while that seems exceptional, they're soon to be part of the norm worldwide. So we're looking at this map, which is projections for high heat or excessive heat days in 2100, given current temperature trajectories, carbon emissions trajectories. So as you can see from this, by the year 2100, some of the most densely populated and poorest parts of the world will experience more than 200 days out of the year where it is simply too hot to work. In places like Latin America, South and Southeast Asia, and Central Africa, it will be too hot to work outside nearly all year round. This has major consequences for labor, agriculture, construction, and, as a result, migration. While we don't have a full accounting yet for the number of outdoor laborers who died of heat exposure this summer, estimates average say, according to the Bureau of Labor Statistics, we're saying about 40 outdoor laborers a year. Now, nobody actually thinks that is the number. A lot of other organizations will put that at anywhere between 600 and 2,000 deaths a year. And we know the toll is climbing, but by exactly how much we can't really say because heat deaths are often reported as cardiac arrest, respiratory failure, acute kidney injury. This means that heat is more often than not a hidden cause of death and disability in the workplace, with significant consequences for labor law and healthcare costs in the United States and globally. So that lack of data translates into an anemic policy response. We do have some data proving that heat protections in California, for example, improve productivity, but it's not enough to make a business case for changing labor regulations. And if we don't have the data to prove that a lack of protections leads to an increase in death and disability, it's hard to make the regulations case. So it's funny, heat is the most obvious consequence of global warming, but it is one where we seem the least prepared to deal with it. So some of the solutions are twofold. Slowing the carbon emissions that contribute to climate change is one, but another one is getting ahead of the consequences for labor by improving data collection and establishing effective protection mechanisms.
Thanks so much, Aryn. Thanks, Aryn. Barack.
Oh, thank you so much. A great introduction by Aryn. I am from Kuwait. Kuwait is one of the hottest countries in the world. So I grew up all my life in school and working, and everything was in very hot conditions. And I'm also a medical doctor, so I was trained in medicine, and I was trained in public health, and I practiced medicine in Kuwait. And the things that I saw in Kuwait while practicing medicine is what drew me to be probably why I'm here in this great panel. And it is that we're seeing things that we shouldn't see. Young and healthy, otherwise healthy workers are just showing up to the hospital with conditions that are preventable. And these are the things, these are the questions that we started to ask. And that grew because Kuwait is an amplification of the problem in a sense because, one, heat is very pervasive in Kuwait. The temperatures, I speak Celsius, so the temperatures reach 50 degrees Celsius. I've been told that's triple-digit Fahrenheit here in the US, very, very hot temperatures. And because of that, we see the high end of that exposure to human health. So that gives us a unique opportunity for the science, actually, to study what is going on with workers. And we started to see this problem. And in Kuwait and in many other Gulf countries, Qatar included, Saudi Arabia, the UAE, Oman, and Bahrain, about the majority of the population is migrant workers. In Kuwait, it's about 70% of the population is migrant workers. Now think of that, 70% of the population are migrant workers, and they are exposed to extreme hazardous conditions. Heat is one of them. But if you look at the vulnerability of workers, it is layers of vulnerability. First, the access to healthcare. Well, that's hampered. There is no access to healthcare as good as the national citizens, so that's one. And at the community level, they live in deprived communities. Most of these neighborhoods are cramped, unhygienic. There are no options for physical activity or no options for leisure or anything like that. So that's the community part. And then you get to the workplace, and there is a restriction on the visas known as the kafala system. Basically, you cannot change your employer. You cannot quit the job. You're at risk of deportation without the agreement of the sponsor at the time. So these are clear challenges, and that leads to longer work hours, less pay, room for exploitation for some employers. And then heat is just that cherry on the top. Like, in addition to all of this, you're cutting through layers and layers and layers of the worker's health. And that's what we started to see. Now, I'm trained in public health, and in public health, they teach you one thing. The worker population is healthier than the general public, because we know the general public there's comorbidities, there's the elderly population, there's a lot of problems that could exacerbate the effects of heat. But what we're seeing in other parts of the world, because of climate change and because of the excessive levels of heat, is that even those workers, they're supposed to be young and healthy and fit otherwise, but they're having worse outcomes. And we looked at it in terms of hospital admissions, and we're looking at it in terms of mortality, and there are many things that are happening. So the government is grappling with this issue. And there are many ways that you could tackle this. We could talk about regulation all day. And one of the issues, one of the remedies for this that was proposed in Kuwait and in other Gulf countries was to have this midday ban of hours. So you're in construction and work starts at 7 a.m. If it gets to 11, from 11 a.m. until 3 p.m., you stop work. So that's the policy, basically. It's simple, it's easy, but unfortunately, that's not how the science works, right? So you can get heat stroke at 10:59 or 1 minute past 3, and so it's not calendar based. It's there must be a risk based. So you have to measure how much heat that the workers are exposed to. So these are the challenges that we're seeing, that there's no straightforward solution for this, but we know enough to act about this, and that's how I got into this, and that's how we're progressing the science here.
Great, thanks so much, Bara. Meredith.
Yes, I am focusing on pregnancy and extreme heat, which are not a good combination. In fact, there's a massive epidemiological evidence that shows that outcomes from pregnancies exposed to extreme heat, there's higher risks of premature birth, of stillbirth, of low birth weight, of congenital defects. And there's also risk to mom in terms of hypertension during pregnancy, diabetes, and really severe illness during labor and delivery. There was a striking study done in Southern California in the Kaiser Permanente system looking at 400,000 births over 10 years. And it found that in pregnancies exposed to extreme heat in the third trimester or periodically throughout, we're at 27% increased risk for these very severe events during labor and delivery, requiring blood transfusions, and they call them near-miss cases of maternal mortality. People survive, but it's very touch and go. So why do we have this association of really poor outcomes for mom and fetus with extreme heat? Well, unfortunately, there's been very little biological research on this. It's the underlying mechanisms are poorly understood, but we do know some basic physiology about the pregnant woman or person. She's got a lesser ratio of skin or surface area to her body weight, so that means she has proportionately less ability to offload heat through sweating and evaporation of that sweat. She also, even relative to non-pregnant women, has a higher proportion of body fat, and body fat is insulating, and it also heats up quicker than other body tissues. And then finally, you've got this passenger here who is like a little heat machine just generating a lot of heat. So those are the disadvantages at which a pregnant person works during extreme heat, or a steeper hill to climb to keep cool. And humans have to keep their core temperature at 37 degrees centigrade. After you get into higher temperatures than that, you're at risk of heat stroke and ultimately death. So among the biological theories about why this happens, the leading one is that there's poor placental blood flow to the fetus in extreme heat-exposed pregnancies. There's been some really convincing studies in pregnant ewes exposed to chronic heat stress that had, just underdeveloped low birth weight and sometimes stillborn baby sheep, lambs. So what about this in the global context? Well, there's 1.4 billion plus or minus women of reproductive age living in lower and middle income countries. So you have a massive exposure, and many of them are required to work outdoors, whether hauling water, gathering firewood, farming. Women constitute, according to the FAO, about 43% of the agricultural workforce in developing countries. Even in the US, though, this is not on people's radar screens. There was a recent study that looked at 74 different public health websites at the federal, state, and local levels in this country, and found that of the 74, only 7 flagged pregnant women as a vulnerable group, and only 6 had advice on how they could protect themselves. If it's hard in the US, it's harder in developing countries where women have less agency, where the political village level power structures are very difficult to negotiate around, like not having to walk so far in Kilifi County, Kenya, in extreme heat to collect water when you're pregnant. Those kinds of things are just beyond the reach of many women to control or avoid. They also will sometimes change behaviors, studies have shown, to basically avoid what would be healthy behaviors, such as walking many kilometers to a healthcare center to deliver a child, and one can understand why someone would not want to do that in the middle of an extreme heat. So how can we protect women? Well, the first problem is to let's redo models that estimate biological vulnerability to extreme heat based on 150-pound healthy young men, which is how those models have been developed. And they obviously don't speak to the situation of pregnant people. Ollie Jay and Adrian Gordon at the University of Sydney, who I visited with when Pulitzer funded this feature I worked on pregnancy and heat, they are working with a climate chamber where you can set humidity, heat, and wind and other parameters to mimic various combinations of conditions. And they will, beginning in January, be testing 270 pregnant women who will be cycling in these varying conditions in order to see at what point they can no longer maintain that stable internal temperature of 37 degrees centigrade and reach an inflection point when it becomes dangerous for them and the experiment stops. They will use data from those women as well as from hundreds of women in rural Bangladesh and urban India who will be wearing temperature sensors to feed a model that they hope ultimately will result in an app where a pregnant person anywhere in the world can plug in their age, their week of pregnancy, and their zip code or zip code equivalent, which will link to weather data on that day in that place to get a readout that says you can be outdoors at this temperature for this number of minutes at this level of exertion. That's what the aim is, to get really usable data that can help protect individuals at an individual level. We're obviously a long way from that, but that is the goal. What other points of leverage do we have? There was a study in rural districts in northern Ghana that showed that cash transfer payments to economically vulnerable women actually mitigated the effects on low birth weight of extreme heat. So cold hard cash, if only it were more available. And then finally, Anna Bonnell and her group in the Gambia have been working with pregnant subsistence farmers, and they have found that the third trimester of pregnancy and or humidity above 50% tips the women into much more difficult physiological reactions with poorer outcomes for mother and baby. So can you, for instance, if you can't make the argument that a woman, gets to stay home in this rural village throughout pregnancy, can you protect her in the third trimester, for instance? Can we do targeted interventions? So those are some of the thoughts I've had and things I've learned, but this is an exploding field, and it's good to know that there will finally be more research in this area.
Thanks so much, Meredith. Doug.
Great, thank you, and thank you for the opportunity to be here and talk about what OSHA is doing to address heat hazards in American workplaces. I want to make a couple of points to start out, just contextual. One, if you're not familiar with Occupational Safety and Health Administration, we regulate occupational hazards, hazardous substances, and harmful physical agents in the workplace. Our focus is on protecting employees of employers, so we don't cover independent contractors, for example, or self-employed individuals, but the bulk of Americans who work in workplaces are employed in a traditional sense. That's our jurisdiction. With respect to heat, while the subject of today's panel is the impacts of global warming, I think that it's also important to remember that this is not a novel hazard for workers who are engaged in physical labor. The Romans wrote about heat hazards, when thinking about the Roman army. OSHA was created by the OSHA Act in 1970. In 1972, NIOSH, the National Institute for Occupational Safety and Health, created a criteria document recommending that OSHA develop a heat standard to protect workers. And so, these are not new issues. However, they are to a great degree newly emphasized and newly emphasized as a result of greater recognition of the impact of global warming and just the steady drumbeat of activists and worker advocates who have really pressed the issue and I think are a big part of why OSHA is acting now to do more to regulate and prevent heat illness among workers. So we are currently engaged in rulemaking to develop a standard to protect workers from the hazards of heat. It is it's based on a rich scientific body of evidence about hazards, well understood, I think common sense approaches to how to mitigate the effects and impacts of heat. We proposed a rule to protect workers in July of this year. We are currently in the rulemaking process where we have proposed the rule and we are accepting public comments. So first we encourage those who haven't looked to go to our website and to consider how they can comment on the rule. We've asked a number of questions in that rulemaking to elicit additional information to help us strengthen that rule and to strengthen the scientific body of evidence to support it. You can also read the text of the rule as we've proposed it. It really centers around a number of common sense approaches. It requires employers to develop a heat illness prevention program, they have to assess hazards in their workplace. It covers both indoor and outdoor workplace settings. And it is focused not just on heat, but how to mitigate the factors that increase internal body temperature. So it's not just ambient heat, but it's radiant heat from equipment. It's the kinds of fabric that a worker might wear, protective gear. If it's impermeable, increases or decreases one's ability to cool off naturally through your physiology. And it also requires training, hazard recognition, response and to heat emergencies. If a worker is ill or is symptomatic, and also has triggers that require access to water and rest at 80 or 90 degree heat indexes respectively, or using wet bulb globe temperature readings. While our rule is not, while our rule is underway, it's not the only thing that we've been doing to protect workers. In 2022, we rolled out a significant initiative called our Heat Emphasis Program. We've done about 8,000 heat inspections since April of 2022 in workplaces across the country. Our state plan partners have done about 10,000, and it's made a significant impact in raising awareness. A lot of it involves outreach to workers and outreach to employers. We have had a real increase in awareness, and I've seen over the course of not only the last 10 years, but especially in the last several years that we've been doing this work, a growing recognition among employers that they need to do more about heat. They are seeing at greater levels the business case for why it's important to protect their workers from heat. And a growing number of them are supportive of the rule, although we might have differences of opinion about how to address heat in a regulatory context. The last thing that I'll mention is that heat can really strike any worker. I remember the first fatality of 2022, not long after I had taken the job at OSHA. It was a young man in his 20s. He was working in Florida. Notably, Florida is a place where a lot of employers have complained that our triggers are too low because it's so often so warm in Florida. But this was a young man in his 20s, healthy. He was a H2A worker working at an orchard in Florida, and he complained of symptoms. The heat index was about 86 or so. He was found later in an irrigation ditch. He had died from heat, from severe heat illness. And it just underscores the importance of acclimatization in the development of a heat program. Workers who are not acclimatized are at much greater risk. About 75% of worker deaths happen in the first week on the job. And it's just an example of how simple administrative measures can protect workers, like gradually acclimatizing them to their work, making sure they have rest, water, shade, making sure that they're monitored, especially in those early phases of work or when they're returning from a break to work in high heat environments. And if we take these measures, we'll save many lives, as my fellow panelists said. While the official BLS number is around 40 a year, our model suggests it's over 600, and others suggest it's closer to 2,000 workers who die every year in this country. At 600, it would make it the second leading cause of death among workplace hazards, or maybe third behind if you include traffic incidents. So tremendous impact on the workplace, and that doesn't count heat illness and injury. So thank you.
Thanks, Doug. Cathy.
Thanks so much, and what an honor to be on a panel as a labor advocate with reporters and medical folks and policymakers, because for so long, workers have known that this is a huge issue. And it's really important to say that for so many years, people talked about agriculture as a big issue, but what we're finding in the labor movement, it's agriculture, it is indoor, it is Amazon warehouses, and I'll talk a little bit about how workers are organizing. And so one of the things we've done is, first of all, at the global level, so I represent 200 million union workers around the world, at the global level, at the International Labor Organization, we have pressed to make occupational safety and health a fundamental worker right. So the International Labor Organization creates global standards. It's a unique United Nations body because it brings together unions, employers, and governments to create standards. And so a couple years ago, we advocated to make sure that occupational safety and health is a fundamental worker right, because no worker should be dying from heat. No worker should be exposed to negative OSH impacts. And so earlier this year, the International Labor Organization released a report, Heat at Work, which I think many of us have read, and I would encourage folks who are working on this issue to look at it. Their statistics that 2.41 billion workers, or 71% of the global workforce, is impacted by heat stress. And we know not all workers are equally impacted by these stresses. And we already heard about pregnant workers, we heard about migrant workers, and I will add to that informal economy workers, which is the bulk of workers in the world. These are workers that do not have formal protections. We even heard here in the United States that OSH regulations don't protect many of those workers, and actually OSH regulations don't protect many of our public sector workers in many of our states. And so we have a lot of gaps both in the United States and globally, but informal economy workers have a double whammy. So they are workers living, we see the heat map up there, we did, in countries that are incredibly hot, and many of them actually work in their homes. And so their workplaces are their homes. And so one of the challenges we are facing is, how do you address heat stress when it's both the workplace and the place folks are living? And so I wanted to give some examples, because for us the answer is both policy, but we know that governments change, and so you cannot always rely on governments to protect workers. And so for us, it's about organizing. We clearly link you were talking about power, because this really comes down to power imbalance. If a worker cannot say to their employer, it's incredibly hot in Florida, I need a rest, and the worker says, or the employer says, no, you need to keep working or you're not getting paid, that worker is probably going to keep working under incredibly hard conditions, and that is in Qatar, that is in India. And so for us, you need to address the imbalance of power, and you do that by organizing a union, by having workers come together collectively and say, we need a change in workplace policies. And so we have great examples of this happening around the world. In India, warehouse workers are organizing to address the heat, and this is with a global organization, a union organization called UNI. They have a campaign to address heat in the Amazon warehouses. You can imagine how hot it is in India, and you are a warehouse worker. One of the most innovative strategies is the Self-Employed Women's Association of India is the largest all-women union in the world of informal economy workers. And what they recognized is the need for new social protection policies. And that's one of the concrete things. I think you started, Meredith, to talk about that around maternity issues, but we really need expansive social protection policies. We currently don't have those policies. If you are sick in the United States and you need to take leave, or in other countries, there are not many protections for that. So the Self-Employed Women's Association created a very unique insurance program. And these are women in India who roll cigars, they sew clothing in their homes, they roll incense. And so what they developed was a parametric insurance program. And this program is different because they don't have to wait for a calamity to happen. What it says is that we know there's a trigger temperature that happens in India, and they can not work. They can get paid. They have social insurance, and they can stand up for themselves and say, today is not a day I'm going to be working in extreme heat. So this is, they are testing this in India, but these are the kinds of innovative strategies that we need to see in our own country, in countries around the world. We will need new kinds of insurance support for workers who need to take breaks, who are ill due to extreme heat. I would also say, we had a great example in the US, the UPS drivers, and there was extreme heat for UPS drivers. And again, the union here in the United States, the Teamsters, negotiated to alter and to make sure there was greater ventilation in the trucks. The connection between the right to organize a union and to address health and safety issues is critical, and that is why we find more vulnerable populations like migrant workers, like agricultural workers who aren't protected in our country by fundamental labor protections, and around the world, they are less likely to speak up. And so the labor movement is very focused on educating our members about heat stress, educating about the connections between their right to form a union and giving them that power to address heat stress. It's a powerful moment when workers can sit down in what we call social dialogue with government and business to say, here's how I'm impacted, what are the solutions, how can we come together? I know we'll probably get to this, but we believe in the labor movement there is a deep business argument to be made here. We know that workers who are impacted by heat, their livers can be impacted, they don't function mentally as well, and there is a strong impact on productivity. And so I think we need to look at this when unions sit at the table with their employers to negotiate. There is a win-win here. The last piece I would talk about that we need to address and that unions are talking to employers about is the need for appropriate PPE. Currently, PPE is really formed for white men on construction sites. And so what we have found is one PPE in extreme heat is usually not appropriate. We need new kinds of PPE. If you are, again, an incense roller in India, you don't need the same PPE as somebody here on a construction site. And so we need to test PPEs that fit different bodies and different faces, making sure that women and migrant workers have effective PPE. And so that is one area of work globally that the labor movement is working on with employers. So I would end by saying, this is definitely on the agenda of the global labor movement. We are looking to educate, we're looking to advocate on policy levels, but at the end of the day, we believe workers know best. When they have power and they can address the imbalance of power in their workplace, they can come up with the needed solutions, and there can be win-win solutions to make that work for both employers and for workers in all kinds of workplaces. Thanks.
Thanks so much, Cathy. Well, we promised you a variety of perspectives, and we definitely have that on this panel. Really good opening presentations. One thing that came up in a number of the talks was data, or what we don't know. Aryn talked about it as kind of a chicken and the egg problem. We don't know enough about the toll of heat to come up with, to come up with protections. Barak said, well, we actually do, at least in the Middle East. So I'm wondering if there are areas of data, things that it would be really good to know to come up with more effective protections or to make the case for them. For any of you.
Well, I think it's important to understand we really don't have a systematic surveillance program for occupational health in this country. So it's really a patchwork of sources of information, and that can be very limiting. I was on a diplomatic mission to Japan as part of my job, and we were exchanging information about our approach to heat illness, and the Japanese were showing a higher rate of fatalities from heat than the official US data. Well, it's not because Japan has a more tropical climate than the United States. It was because they had better data on who's dying, and still, like in all likelihood, almost certainly an undercount. That was really just the acute effects of heat, and B, probably nonetheless an undercount. And I think that's a challenge, and one of the reasons we have to rely on modeling and comparative data.
One thing that did come up in my reporting is it's also cause of death on the work site. So both in Qatar and in the United States, when somebody comes in collapsing at a work site or dying at the end of the day after working all day in high heat, the cause of death is considered heart attack or respiratory failure. And very rarely does a coroner or anybody else put antecedents, a causative factor. So we also need to start looking at medical admissions and maybe thinking about how we diagnose death on a work site and sort of look at some of the contributing factors as well as just the immediate cause of death. And I think that's something that I've been talking to doctors in various emergency rooms that are starting to bring this in the climate context. But I think that would be another way to start thinking more about the contributions to death on the work site.
I would just say a big gap is that most countries of the world don't have an OSHA, right? Most countries of the world don't have a central place where they're collecting data. And so, I mean, again, that's why we start from the ground up in many of these countries, going to the folks that know best, which are the workers in the workplaces, and doing worker surveys, asking them for the information. But, when we talk here about the challenges of policy making, even in the context of the US, we have to remember that most countries of the world don't even have a ministry that has the capacity to address heat stress. And so, the reports of the International Labor Organization are trying to stimulate this conversation between government, employers, and unions so that we can start, figuring out we can get data, but if the data cannot be used for effective policy making, we've got a big issue. So I think one of the big areas we need is to look at how ministries, whether it's the Ministry of Health or the Ministry of Labor, like what we do here, actually have the ability to take data and translate that into effective policy, and then we need to make sure that policy is effectively implemented and impacts the lives of working people.
And Barak.
Yeah, I just want to add one more point here on death certificates. And this is really troubling because you need to write the primary cause of death. And that can have different classifications by the doctor that is filling this death certificate. And then far too often is that the doctors would put the primary cause of death as something like your kidneys shut down or your heart stopped or things like that. But in fact, heat does not make it into the death certificates. And that may not be the problem of the physician that is filling this form, because the patient really presented with a heart attack, for example, but that heat contributed to it. So you see, there are levels of the problem of documenting heat and counting how many heat deaths that we have here or in Japan or in the United States. I think, and I come from academia where we always want to get more data. We always want to get more science, and I can design the most expensive study that you could ever think of. But the fundamental question that I believe is that, do we have enough data to act? And for me, that's a resounding yes. At least what we could do is just guarantee the fundamental rights. And these are access to shade, access to water, and just rest. And this is simple. This is not rocket science. There is an expansion of data right now. Wearable devices, we talked about this. They're amazing. You can quantify how much sweat. You can quantify your core body temperature. And these are picking up. Things are working like your phone, with whatever you're wearing. And the data is coming. Do we wait until we get the data? Or do we act to at least have some sort of fundamental protections?
Makes sense. So we have enough data to act. It's clearly a problem. And in some areas of the world, action has been taken. Right? Some states in the US, you talked about some of the measures taken in the Middle East. Are there any models? Are there any good models? And what are the shortcomings of the measures that have been taken so far?
I can start by noting that California has had a heat illness prevention standard protecting outdoor workers for some years. I think one could argue when it was fully in effect, but 2007 or 8. And it saw a significant decrease in the number of reported deaths from heat illness, primarily protecting workers in agriculture and construction. And it has not prevented all deaths, but I would wager it's resulted in a 2/3 to 75% reduction over time compared to the several years prior. And it's quite simple, right? There's a heat trigger, and it requires periodic rest breaks and cool water and a few other requirements. It's focused on particular high heat industries. And I think that there's a lot of lessons in its simplicity and its effectiveness. Doesn't mean that more couldn't be done in following the science and broadening the protections, but it shows what can be done with simple measures.
Does it include a sort of measures for acclimatizing, for keeping workers out of the most intense heat during their first days on the job, for instance?
The California rule does not include acclimatization, although it does have requirements around monitoring, I believe. But there are no acclimatization requirements that I can recall.
Cathy?
I can give a few examples. I think there's, again, from the bottom up, and there's movements. The Adelante initiative in Nicaragua reduced kidney injury cases by 94%, and productivity. They increased productivity by 10 to 20% through just mandated breaks, shade rest, and hydration. The Sri Ramachandra Institute's plan in India improved productivity by 57%, reduced worker attrition, again, by implementing shaded areas, sanitation facilities, and electric vehicles for heavy loads. So I think one piece I want to bring into this is we have tools in our toolbox currently. We have due diligence regulation. Corporations are supposed to look at the harms in their supply chain. We have things that companies can do proactively without waiting for government regulation. We had the case, we were talking about the sugar women in the sugar fields of India who are being forced to have hysterectomies due to extreme heat. They work for supply chains for major cola brands here in the United States. These companies know, they have systems of doing due diligence in their supply chain. So one thing about this issue is looking at the tools that already exist. And I would just say, I think there are companies that already know how to look at worker rights issues in the apparel industry. We've been doing this for years in the electronics industry. And so we don't need to reinvent tools. We need to effectively use tools that we have in regulatory policies that already exist, in addition to expanding policies. But I know workers can't wait. As you see the shift in what's happening in the world of how elections just played out, I'm not sure many of the people, in the new elections are going to put health and safety as a key policy priority. That means that working people need to advocate and come up with their own solutions and work with employers and use tools that we already have.
Yeah, I just want to highlight the Adelante initiative in Nicaragua, and this is by the La Isla Network. And what they did is remarkable, because in Mesoamerica, in countries in Nicaragua, El Salvador, Guatemala, there is an increased rate of non-traditional chronic kidney disease among those that are young, that are otherwise in their 30s. And what's common is that if you plot this on a map, is that you don't need fancy epidemiology degrees. You could just clearly see where the sugar mills are, and you could just clearly link this epidemic of chronic kidney disease of non-traditional cause coming from heat. So what they did is that they actually worked with the community there. So they worked with the community for a number of years. They implemented simple stuff, the things that we're talking about: rest, shade, hydration, and having organizational also effort working with the sugar mill. And the results are so successful. It was one of the most remarkable stories that we have right now is that they saw a reduction of 70% of admissions for chronic kidney disease and acute kidney injuries. But we were talking about this earlier, and it's also the productivity of the workers increased. And that defies this assumption that we have, is that all the heat production measures that we have are counterproductive. Cathy was just mentioning this about the productivity of workers. You cannot continually run down the worker and expecting that the work is going to get done and the construction deadlines will be met. This is not going to work. And in Nicaragua, there is an objective measure of the worker productivity, because it's piece rate. So how piece rate works is that by the end of the day, you get all the crops, you put them on a scale, and then you see how much you gathered during that day, and you get paid based on that. And they saw that when they implemented the rest breaks, which means that the work time reduced now, the productivity first plateaued and then increased by 9 to 19%. So all in all, the return on investment on these things was documented at around 20% return on investment. So there is a business case as well for this, and that's using that successful example.
Are there cases in which the business case for heat protections has sort of won the day? Employers have responded to this argument by implementing heat protections for their workers, in expecting that this will basically improve productivity and profits.
I have to go back to, I mean, it comes from organizing. I don't think we've seen a lot of businesses saying, let me invest in more shade and more water, and unfortunately, right? I mean, there is a cost to it, and so most of the examples have been through community organizing, like the Nicaragua example, union organizing in the Amazon warehouses, the UPS example of the Teamsters. And so, again, when there is an imbalance of power, what we have found is it's not like most companies to date are just saying, let me completely change how I do business and provide all of this. We think it seems quite basic, like it should be a part of doing business, but to date we haven't seen that as the model, which is why we believe you need workers to organize, the right of workers to organize unions and to have their collective voices heard so they can shape these policies. All of the examples I have are coalitions, community-based organizations, the ANROEV network from Asia. It's not one by one that we make these changes. I mean, I hate hearing your story about the person the worker who died. They were alone, they were isolated, and they felt like they didn't have the power to speak out. That's what we need to change so that we can then shape these important policies.
I would add that scientists can play a role in generating knowledge on this. I was just corresponding with Ollie J, the same person doing the climate chamber work at the University of Sydney, and they have new work coming out on Bangladeshi garment factories showing that adding combinations of a green roof, fans, hydration in various combinations have really discernibly and significantly reduced for women on these factory floors heart rate and dehydration and core temperature, so that that's data. And they did run a secondary productivity analysis and found productivity improved. And these aren't like super expensive measures, like a green roof is an initial investment, obviously, but fans and hydration, so with that data in hand and that paper in hand, maybe those employees have a leg to stand on that they didn't without the research.
One other thing to add is also employee retention. I mean, that it is expensive to lose an employee either due to illness for paying for a compensation or just to losing the employee and the time put into retraining. So keeping a happy, healthy employer also has has a business case to be made.
I know employers don't like accidents, and I imagine that heat can raise the risk of accidents. Is anyone making that connection?
Yet there have been recent studies on the decline in sort of cognitive ability when you're affected by high heat, and that leading to an increased number of accidents. Some estimates suggest that as many as 100,000 injuries in this country are preventable every year, and that heat is a contributing factor for that reason. And I would just certainly echo that I've certainly heard from employers about the retention issue in a tight labor market, especially in high-skilled trades like in construction. It's been a motivating factor for employers.
So I have a question that came to mind when I was looking at Aryn's map of the number of days above a certain heat threshold expected. Was it in 2100? Mm-hmm. Anyway, quite frightening. Is it going to be too hot to work? I mean, reading the reports from Phoenix in recent summers, it seemed as if we were already reaching that point some of the time. A lot of work had to be done outdoor work had to be done at night. What ideas do people have about how to cope with a world when you can't have people harvesting crops during the day or doing maintenance work?
Well, we're already seeing it, people working at night. Construction, Qatar, I'm guessing Kuwait, Saudi, a lot of construction happens at night. When you're driving around the Gulf at nighttime, you pass massive construction sites that are lit up like a Hollywood studio. And that's where the construction happens. There does reach a point, I think, where you can only do so. You can't harvest watermelons or peaches at night. You're not going to floodlight an orchard. So there are limitations to what you can do, but there's also some technological innovations that you can work. Water best shade is fundamental. When you get beyond that, then do we get to a point where you start air conditioning a work site? I'm sure in the Gulf there might be a monetary advantage to that, maybe not elsewhere. There are certain kinds of cooling clothings that you could use and implement. But ultimately, I think, part of the conversation also has to be how we make sure it doesn't get that hot.
And I can add one more thing. It's not just outdoor work as well. The indoor environment can get very hot as well if there are no air conditioning and the temperature is not controlled, and it can get really hot. In the proposed rulemaking by OSHA, those are working in commercial kitchens here in the US. They're number 3 of the most affected category of workers. But there is a way out for the indoor employers. And even in the OSHA proposed rulemaking, if you're an indoor employer, you can just put an air conditioning that lowers the temperature below 80 degrees Fahrenheit, and then you don't have to worry about putting all the other measures. So there is a way out for the indoor workers and the indoor employers that might not be so clear for the outdoor work as well.
Cathy?
Yeah, I was just going to add that I think as we've spent a lot of time talking about the work-rest cycles, hydration, all of that, I do think to this question, you're going to need to get to engineering controls, alternative building materials. When I talk about that the bulk of workers are informal around the world, they're working in their homes, they're working in, informal structures. I think we're going to need really some innovative thinking around engineering controls and what kind of building materials we're using. I think we need some new thinking on this, and I'm not sure, maybe some of the researchers have already seen it, but I think that's where we need to go. There's only so much you can say on a hot Phoenix day or a hot, Qatari day to put a piece of shade up. You just cannot continue to work. And so we fundamentally, I think you're gonna have to look at work time, and again, these are the important issues that often get bargained between workers and employers. That's the importance of that they can sit down and say, hey, we're gonna work these times, and this is what works for everybody. And I think that's where we're gonna need to head.
Great. Well, thanks so much. So the panelists have put all sorts of ideas out about the dimensions of the problem and the potential solutions and the solutions that exist already. And so now we have time for questions from the audience here and from online. I'm going to go to the next slide where there is a survey as well. There you are. If you want to fill out a survey, you can do that. But in the meantime, if you'd like to ask a question, there are microphones in this room. And you can also submit things on the chat. Yeah, if you could go to the microphone, then the people who are watching remotely will be able to hear your question.
Great, thank you. I'm Jeff Wheeler. What I'm curious about is kind of a multiplier effect of heat hazards in the most difficult to manage circumstances. So I work with Pakistani cotton farmers, and we just had a huge toxic wave come in India and in Pakistan. We've had extreme drought, extreme heat, extreme flooding, and so heat is hard enough to manage by itself, but it seems unmanageable to be dealing with toxic air quality and a range of other hazards. And when I've met with farm workers, I naively say, how do we make your work safer and better? And they say, get me out of here. I don't want to do this work. I don't want to be here. But the truth is, there are no other options for them right now. Data collection is very limited. It's extremely hard to organize farmers. And so we have this big problem. And I'm wondering, how do we do a better job of kind of measuring what this toxic combination of heat with other factors, and then how do we grapple with this problem more effectively, particularly at the farm level? Thank you.
That is just a brilliant question. Thank you so much for asking this question. It's just to round the circle. The migrant workers that end up in the Gulf countries, are actually being recruited in areas that are most affected by climate change, with extreme flooding and extreme weather events that we're seeing in Nepal, in Bangladesh. This is active areas where those that are exploiting migrant workers are recruiting them to send them to other countries. And in that, the migrant workers are affected by climate change, but that destroys their farms, put them in debt in order to go and make a living. They go to a destination country, they're faced with heat again, climate change-driven heat. So they're hit by climate change, and I'll borrow the phrase of the double whammy. So that's the double whammy on migrant workers, because you're getting hit by climate change twice in 2 different locations. So they are at the forefront of this. But the solution is not straightforward because you're looking at across borders. So the accountability question is important here. Who's accountable? In the destination countries, when they're injured, they're back on a plane the next day and sent back to Kathmandu in Nepal. And you've seen in the video where the doctors are dealing with an excess number of patients needing dialysis. The resources are not there in Nepal. So there are ways, and even the Department of State here is also trying to help in finding interventions that are across the migration journey. So the pre-departure, what we can do. The journey itself, which is also full of dangers that the migrants take. And then when they get to the destination country, so you can break migration into 3 phases and then plan interventions in there, maybe at small scale, maybe at large scale. Thanks.
I think we had another question.
Thank you so much. I was wondering if you see an opportunity among states and cities in the US to develop specific policy around access to cooling, maybe access to cooling being a human right. And if so, if you think that this change in policy is something that's feasible. I know you talked about the heat standards in California, but if you see something on like a more like statewide level.
There are definitely opportunities for states to act on their own. If a state has its own OSHA, and 22 or so states have approved OSHA plan, they can develop a heat standard. In the other states, since we don't specifically regulate heat now, they have an opportunity to take other types of measures to regulate heat exposure without worrying about being preempted, which would otherwise be a problem if we were regulating. So they can take measures now. One of the unfortunate trends we've seen is that where localities in states have attempted to enact protections for workers, in whether it was in Austin or in Miami, the state has stepped in and actually prevented localities from taking steps to protect those workers. And while I don't have any specific comments on those state-local disputes, it does send a dangerous message that suggests that workers don't have any protections now, which is not the case. All workers are protected by our general duty clause against known hazards. So, but I think that it's led people to think that they have no recourse if they are exposed to high heat work and don't have water, don't have rest, don't have shade, and are at risk. They can call us.
Thank you.
Other questions?
Thank you very much for your outstanding presentation. The status quo, I think, is a reflection of the political choice, right? Whether things are or not happening, things we know that can be done right now to protect workers, whether here or in the Gulf. The fact that they're not done is a political choice. So what I'd like to ask you, all of whoever wishes to answer this, is what is the strategy? What are the political arguments that we can align the arguments that we know will protect workers with strategies that can be actually realistically be adopted in the current political environment? Can we bring in allies like insurance companies and others? Is there something afoot to bring those groups together that maintaining the status quo actually costs them a lot? Inaction costs them a lot. Action will actually be beneficial to them. So I'm really interested in the US context, but also in the Gulf context. Thank you.
Great question, because I think that is the moment we're living in, where we need to not, like I've said, not necessarily rely on governments, especially when we see the outcomes of a lot of elections. I mean, we need to both push. I think we need to be doing both, right? We need to be pushing, advocating for regulation at the national and local levels. But it really, for me, I'm just going to go back to what I said a few times. I think, what workers are doing is taking it into their own hands, and it's bottom up. A couple thoughts. I do think there's some pilot programs like the one I mentioned in India, and they're trying to figure out how to expand it, and some foundations are investing in it to really look at, we do need new social protection. I mean, the social protection system is not fit for purpose for the transitions coming at us around clean energy, tech, or heat. So, that's a huge, beyond kind of just thinking about heat regulation, we need social protection. So we're doing some piloting in these countries and trying to figure out best practices. I think we're going to need to expand them. Networks like the NROEV network is in Asia. It's a coalition that does best practice exchanges so that groups can train each other on what is working from the bottom up. But I think, what you're hitting on is this is a really challenging time because it is now. People are dying, and governments are moving quite slowly, the political challenge. And so, at least from a labor perspective, we're going to keep on educating our members about heat stress, because a lot don't even know about the impacts of heat stress and what it means for their bodies. Advocating for policies. I think we need a global standard, and I would just end on that. I think the fact that we've recognized globally that OSHA is a fundamental right, what a global standard would do for us, like right now we're negotiating a global biohazard standard at the International Labor Organization. We need a heat stress standard so that governments don't have to reinvent the wheel. If you don't have expertise in your country on these issues, where are you turning for best practices? Of course it's not going to be high on your priority list. You don't have expertise. So I think the labor movement, I'm hoping we will continue to push for some kind of global standard that we would negotiate so that you're not reinventing the wheel country by country. Here is the standard that employers, governments, and unions negotiate, and it becomes a negotiated standard, but one that can be cut and pasted into law. And we have seen this over and over, from gender-based violence to domestic worker laws that have been negotiated. Countries that don't have the expertise use these global standards as their high point. So just one thought from a labor perspective.
Doug, do you want to say something?
Sure. So there's law called the Small Business Regulatory Flexibility Act that requires certain agencies to take an extra step in rulemaking. And there's 3 of us that are subject to this rule that makes our rulemaking take longer. One is the EPA, which protects the environment. One is OSHA, which protects workers. And the other is the Consumer Financial Protection Agency, which protects consumers. So, and I think it's based on a narrative around what we do being oppressive to small business. And that's a narrative, a political narrative, that it's important for us to overcome in our engagement with the public and with stakeholders. And to make sure that we are doing common sense rules that small businesses can have the flexibility to comply with, and also not being afraid to press the moral question about this being about saving lives and doing the right thing, because these are not complex, costly proposals. And I know when I was in California and would talk to farm labor contractors, where again and again we were citing employers for not providing water to workers, and they would complain about the logistics of it, and I would ask, well, do you run out of lettuce boxes? Do you? No, I mean, and the answer is no, of course. So it's just about sort of common sense arguments and prioritizing worker protections.
So we have time for one more question. Yes.
Hi, thanks for organizing this panel. It's been really interesting. It's an issue that concerns me. I'm an independent journalist. I've written about migrant workers, not so much related to, or not related at all to climate change. But I had a question, I guess. I feel like some of the solutions that we're offering a little bit contradictory in that they contribute to climate change in themselves, in that, you know, the working at night, working at night means using more energy contributes to climate. So those aren't really solutions. And, you know, I was in DC, I think this summer and last summer that were extremely hot, and we were told to stay indoors and crank up the AC. And I just think that these are very short-sighted solutions. I don't know if the scientists or policymakers among you have something else to give us more hope about the future, because I don't think those are long-term solutions. And then another question I had was about the rule that Mr. Douglas from OSHA, you mentioned. How is that likely to move forward? Will it be approved in time for by the end of the year, or how do you expect that to evolve? Thank you.
The AC, the air conditioning, and then OSHA. Yes, it is not connecting dots from A to B. Our colleagues right now in Azerbaijan at COP29 talking about mitigation, which is lowering our contribution in carbon dioxide. So that is very important. But there are two sides of responding to climate change. Mitigation is one, and then adaptation is the other. So we'll need to be creative in finding ways that we can be adaptive to and resilient to the current climate. And in the workplace, there are engineering controls as well. There has been some research right now about changing the landscape and adding more shade and having surfaces that are reflectant. That lowers the temperature, and that could also improve the conditions, using engineering controls as one example. But I don't have a straight answer when it comes to that. It is difficult, and we'll have to find some sort of balance.
And as for the heat illness prevention proposed rule, it will not be finalized during this administration. We are still accepting comments on the proposal, and then after that there would have to be an analysis of those, then a public hearing, and then a drafting of a of a final rule based on those comments. So.
Before we wrap up, I am going to spring something on the panelists, and you feel free to shout me down. But I was going to ask each of you to give a very short takeaway for our audience. 3 sentences. What would you like people to come away from this discussion thinking, or what message would you like them to come away with? And we can start either with Aryn or, well, we can start with anyone.
More time to think.
Yeah, right. Meredith, are you ready? Look like...
I just want to circle back to the very first question you asked about, what more do we need to know, and agreed about the death certificates and other things. But bottom line is, which I wanted to say, is like, we know what we need to know to make things better. I'm, even just thinking of pregnant women. It's not complicated, and political will is just sadly lacking in so many instances when people are voiceless and can't raise their voices on their own. I'm just thinking of Adelaide Lusambili, who's a medical anthropologist in East Africa, who I interviewed for the Pregnant Women's Story, and she had interviewed dozens of women and their partners and their mothers-in-law and so on in this rural Kilifi County, and her bottom line was, these women need help, and they don't have what it takes to at least at this minute, create that help for themselves in a lot of spaces. And so, I see it as being on us globally as a community.
Well, I would just make a kind of a connected point, which is that one of the things we didn't talk about, at least domestically, was particularly vulnerable workers in the United States. Thinking of immigrant farm workers, for example. When I was in California, we had thousands and thousands of complaints about COVID and COVID exposures in the workplace. There was one category, one industry in which the number of confirmed worker deaths exceeded the number of complaints, and that was in agriculture. And it just underscores how reluctant so many workers are to speak up because they don't trust government. They're perhaps from a part of the world where they fear the government, they fear a connection between a government official and an immigration response, and these workers don't step forward. And while this is an eminently solvable issue in terms of resilience, not climate change, but in terms of hardening our ability to protect workers, we really have to think about how we reach those most vulnerable workers who are least likely they're most likely to be exposed to the hazard and least likely to trust our institutions in getting solutions and help.
I would say that my day job is taking on what many people would say the impossible, global labor rights issues, and I think so. I would just end by saying this is one that is solvable. When I hear all of this conversation, taking water to workplace. I love your example of can you figure out your box? It's sort of like I get these questions all the time. I don't know what's in my supply chain. How would I ever know what's happening in Bangladesh? It's like, but to the dime, how much you're spending on a button, right? So I think the takeaway for me is this is a solvable issue. And you get an interdisciplinary conversation like this, you really see it's going to be important for us all, the data, the research, the report, the government policy. We're going to need it all. So that's one. The other takeaway is that workers do have knowledge that can address what they need in the workplace. It does not need to be a top-down policy answer. They know if there's a clean bathroom. They know if they're being forced to work overtime in heat. So workers have knowledge that we need to tap into, and we need to give them protections like we did in this country. We have formed some policies that prevent employers from deporting immigrants who speak up about unions' deferred action and other protections, and you need workers to feel like they have power and protection so they can speak out. So workers need a voice, an agency in the solutions. They need to help shape the policies, and this is something that is actually solvable.
Well, they were generous enough to go first, so I took my time to write 3 things that I want to say. And the first thing is that Cathy said it is solvable. I will also add that heat stroke deaths are preventable. Think of the case that Doug mentioned about the worker in Florida that died. Had that worker been pulled, cooled, and rested, that death could be averted. So that's point number 1. Point number 2 is that we know enough to act, and this is what Meredith was just saying. We can go on with the science and try to learn more, but we know enough to act, at least right now. And then the third thing is that we need to celebrate the work that OSHA did to push this proposed rulemaking, and then do our best in the public comments to support and strengthen this proposed rule, and hopefully we can get it out at some point.
Everything they said. But I would also just reiterate the fact that this is not, like the interventions that are necessary now to protect workers are not expensive. They're not water, rest, shade. I mean, that is just so fundamental, and the advantages to a healthier workforce are going to help the bottom line. So this shouldn't be a political issue or a culture war issue or a big government issue. This is just fundamental common sense, and we should start thinking about it that way.
Well, thank you all. So many discussions about climate change and its impacts they have an undercurrent of hopelessness. There are solutions, but they will take a long time. They will take a lot of money, and meanwhile the problem is marching on much faster than the solutions are coming about. But this sounds like this is not one of those problems. This can be fixed. So that is a heartening message. And I just want to thank our panelists for this wonderful, wonderful discussion. So well informed and so lively. So